Hi everybody, this is Sandip Saha from IIT Bombay. So I am a professor in Mechanical Engineering Department of IIT Bombay, and today I will present my personal uh, experience of this Crohn disease. Okay, so uh, basically, let me first tell you that I am also suffering from Crohn disease, and I will describe that how it is detected and what I feel. Okay, and what I felt also during all testing and whatever the treatment I am currently undergoing, basically. So these things I will describe or I will discuss, and also see means you just means if you have any question, just interrupt me and ask me because I may forget many things sometimes. Okay. Uh, so let me start this. So thing is this Crohn disease, whatever means I am suffering from, basically was not from my childhood. Okay, and it started in 2016 only, and around that time my age was something like 37 or around 37. Okay, why I'm giving this example is that to tell you that this can occur at any stage, okay, of life. So now what happens that before that I didn't face any kind of this type of situation, but right means at present and now I realize that okay, maybe my body had given some indication that I have something like this. How I got means why I'm feeling what I'm feeling now is that, say for example, I was doing actually postdoc in Belgium, and then I went to UK for family holiday basically, and then actually one day I realized that some scar or some ulcer has come on my tongue. Okay, and during that phase although I don't like pass bloody stool, which is one of the main indication of this disease actually, but I had something like some kind of fissure or like something like that, but that bloody stool I didn't pass. Okay, anyway, so that may be the indication what I right now I think that my body gave me, but I didn't know about this disease at that time. Okay, but anyway, like when I came back to IIT Bombay or India, then I joined IIT Bombay. It like in 2012 I joined IIT Bombay. Then it was all normal. Okay, and means I used to do lot of exercise and other activities also. Okay, and very frankly speaking, because this may be one of the influencing factor in Crohn disease or any IBD, that I don't drink. Okay, I also don't smoke. Okay, so I didn't realize that this may happen. This may happen to me. I'm telling you that thing. So again, now what happened in 2016, and that day I still remember. I will remember that day throughout my life, and that was actually Diwali date. Okay, in 2026, 2016. So that day, what happens? I visited my colleague's house, and we were actually trying to celebrate this Diwali. Then I suddenly feel urge of passing through. Okay, so then I came back to my house with this because this is in campus, and then I saw that it's something like not a fresh blood. Okay, telling me, which is basically an indication that it coming from anywhere from GI tract simply. Okay, because the color of that blood will be not the red, it will be maroon or black, depending on the location of that ulcer, basically. Okay, now what happened? Okay, I visited that our health center, our hospital, IIT Bombay next day, and they gave me simple like medicine. Okay, so that someone medicine is there. Pause. They used to give widely that medicine to everybody. So I took and it cured within 2 3 days. I stopped passing any kind of bloody stool. Okay. Then they suggested me to do endoscopy. Sorry, endoscopy, and I went to our nearest hospital, and then the doctor did basically. So said they did both the things. Okay, that endoscopy, that is basically colonoscopy, or as well as endoscopy and as well as colonoscopy, both they did. Okay, and the doctor was surprised to see that nothing was there, and she was telling me that how you can pass this thing, this blood stool. So then I told her that means I passed, that's why it came. Okay, so she told me, don't worry. Okay, maybe it may be because of food poisoning. Okay, and if you hear, like, let me tell you one thing that you may have heard from your like relatives or many known person that I pass something like loose stool with blood. Okay, so this is regular. Okay, they used to tell you. Huh? So but they need to pay attention that if it occurs regularly, that means I have to check with doctor that what is going on. Okay, so for one time, okay, for maximum 2 times, it's okay, and if there is a big gap, then it is a good one. It is okay. Otherwise, if it is frequent, he must be checked. Okay, means not only Crohn is there. There are other versions are also there, like ulcerative colitis. Other versions lie, and the end thing is that colon. If everybody knows colon cancer, everything. So these are all the reasons I'm telling you. So anyway, so what happened that doctor told me that you don't have anything. You are okay, and all parameters actually were okay. Okay, like they did blood test, everything. So then I came back and I took normal foods. Okay. So after 6 months, again this happened. Okay. And I again visited that doctor, and then they admitted me in hospital and told me that they want to do again thorough investigation. Okay, including colonoscopy, endoscopy, again CT scan, or whatever the possible tests are there, they carried out. Okay. And again, surprise, only one location, that small ulcer, they only able to detect. Okay. And again, that doctor told me that means you don't have anything. Okay. So you carry on your normal life. Okay. Thing is that I was a little bit worried that why it is happening after 6 months that time. So then I consulted our again hospital, and they suggested me to go to another hospital. Okay, so that is also a very renowned hospital in Mumbai, that is Hinduja Hospital. So then I visited that doctor, and he told me that, okay, this can happen, okay, because of food poisoning. Let me give you some medicine, okay. You take that medicine, and let us see what happens, what is the thing. Okay, so I started taking that medicine, and that medicine is actually imported medicine from Germany. Okay, so from to India. So what happened? Like 1 year, I didn't face any problem. 1 year to 1 year, 2 months, I didn't face any problem. And then I faced small problem. As I told you that depending on that location of the ulcer, that blood color will be different actually. So if it is little bit upper section of GI tract, then it will be a black one. Okay. So seeing the color actually, you can, now I can understand little bit. So you can actually get the idea that where it is happening. Okay. Normally in Crohn disease, it is actually that ileum part, okay, of the body or the digestive system is affected. Okay. So mainly the ileum part and the valve just between the just before the ileum, it will be affected actually. Ulcer will come there. But in Crohn disease, ulcer can come anywhere. Okay, from mouth to say rectum. So that is the thing. So you don't know that where it will come. But normally, this is Crohn is characterized by that portion. Okay, where it will occur. So now, after like 1 year, 2 months, I got the thing that again, not the full blood stool, but that colored chicks little bit. So then I told him this thing, and he suggested me that you should undergo again colonoscopy. So again, I undergone the colonoscopy, and let me tell you that time, like 2016, 2017, and 2018. So colonoscopy was not done under any anesthesia. Okay, only at the last phase of that colonoscopy, they push actually the injection that to make the people unconscious. Otherwise, at least I saw my thing. Okay, like on the monitor. So what is there in my GI tract? Okay, so it's a basically a full pinkish color. Okay, which should be actually. But if ulcer comes, okay, it will be like what I can say. Some skin will be out. Okay, from there. So that is one location. Also, some bloody spot like the blood vessels will also be prominent. Okay, because actually what happens that when food passes, actually these blood vessels actually are teared up because of this passing of the food. Okay, anyway, so that I saw. Okay, nowadays they do the colonoscopy under full anesthesia. Maybe that instruction has come. I am not aware fully, but recently actually I also undergone that. So it is that's why I don't know. Only I see the photo. Okay. So anyway, so that in 2018 also this was again colonoscopy was done, and nothing again they found, and again all my parameters like cholesterol, whatever the other things, the CBC, everything was perfect. Only thing it actually reduced was the hemoglobin. Okay, for like in 2016 also, in 2018 also. So in 2016, the hemoglobin count actually reduced drastically to something like 10. And the doctor told me that I lost 3 bottles of water, the blood, basically. So they didn't give me blood, rather they pushed iron injection. Okay. Anyway, so this is again one of the indication that if the stool is that blood stool is passed, or some blood is coming out from the GI tract, the hemoglobin will come down. Okay, and only checking the CBC, which is basically the test, and the one more test is there which I will describe later. I mean, the doctor can gauge that what is the severity of this problem. Okay. Now, as I told you, this Crohn happens like in a cycle. Okay. And what is the time gap between these 2 cycles? Nobody knows. Okay. So it may occur within 2 months. It may occur within 6 months. It may occur within 1 year, maybe 5 years. Okay. Now, what doctor told me that time that it might be that type of disease, IBD disease, but they didn't quantify what was the disease or what is the disease. So they told me that this disease cannot be cured. This IBD problem cannot be cured throughout the life. So only what they do is that they prolong this cycle basically, okay, by giving medicines. Now, okay, so that time again I am confused. I was confused totally. Again, I visited our CMO, like Chief Medical Officer in our hospital, and I asked her also that what I should do. So then she told me that you shift to another hospital, and that concerned doctor is very renowned in Mumbai, and she was actually during her earlier career. She was visiting doctor in IIT Bombay hospital. So I visited there. So I'm telling you the hospital name, maybe, but not to publicize. Basically, just to tell you that Jaslok Hospital. So that time I didn't have any this problem. So then they did all type of test. So again, colonoscopy, endoscopy, and once test they also did is that TB test. Okay, TB can also occur means everywhere. Okay, not only say in bones or maybe on the chest, but it can also occur in that GI tract, anywhere it can occur. Okay, so and also detecting TB is also very delicate. Okay, it is nobody can confirm. Okay, that he or she has TB. Okay, so in India, everybody has positive TB. If everybody does a test, everybody will get positive. But that is not the case. The detection is not very accurate. What I can say. Okay. Anyway, so all TB tests came negative. Everything came negative again. But she told me that first time that okay, you don't have that H. pylori case. Okay, you don't have any other thing. Only possibility. Then she asked me that did you get any scar on your tongue or anywhere in the mouth? Then I told him, okay, yes, I got in 2012 or 2000 as well as 2016 also I got. So then she told me, yes, this could be a possibility of the Crohn's disease. Okay. Then they did a test, and also like detecting Crohn's disease also requires very accurate instrument. And let me tell you, okay, so it is not very easy to detect with the usual kind of equipment. Okay, you need a little bit high end of that colonoscopy equipment. What I'm trying to say, because what I understood, because from my uncle, because he's also a pathologist, that because of the resolution, you may not be able to detect this. Okay, so the resolution of the instrument plays a major role in detecting these things. And in India, very few hospitals are there who has that high resolution instrument, that colonoscopy thing. Okay, and also the doctor has to be experienced on that. So that's why if you see in India, it is not very widely publicized or widely known. Whereas in US or UK, okay, so they know that who has this disease. And if you see the statistics in US, maybe in 33 million of their population, 3 or 4 million has this disease. You see that out of 10, one has this kind of disease, IBD disease. Either Crohn or colitis, it doesn't matter, but they have. So because their detection system is good. Here, first we don't pay attention what we have attention to this problem. Okay, as well as the equipment is not so accurate. Yes. So anyway, in 2019, they told me that you have that Crohn disease, and then we will start the medication accordingly. So this gave me, there's a standard medication for this. Okay, so they will give steroid first, and they will give anti-inflammatory drug. Basically, they will give, but that anti-inflammatory drug is basically immunodepressant medicine. Simple. Okay, so this will be the preliminary medication. And if this doesn't work, then other medications are also there, like biologics, and then finally is the surgery. Okay, but anyway, I also discussed all these things with my doctor. But at present, I am on this basically anti-inflammatory medicine. I am okay right now. Now, let me go back to again 2019. So when I started taking the prescribed medicine, then initial days, obviously, my body did not accept those medicine. Okay, I felt stomach pain, all kinds of pain actually, because those are side effects. Okay, so then she told me, okay, you have to bear with this, doctor. Anyway, in 2020, after 1 year and 5 months or 6 months, again I got that symptom. And then again I visited us, and 2020 is during that lockdown period. And I was amazed that why this happened, because I was not going out of my apartment, and I was taking only minimal food. Everything means normal, everything was normal, and why it happened basically. So then, anyways, she again did colonoscopy, and again they increased the doses. Actually, they only handle the reduce the symptom by just increasing the doses of the medicines. Either they will increase the dose of the steroid. Normally they used to give high doses of steroids initial days, then they reduce it, then they will actually increase, or they will start the anti-inflammatory drug basically. Okay, so that drug, anti-inflammatory drug, means when she gave me and I googled it, I found that these drugs are normally used for transplant patients, that who has kidney transplant, who has other type of transplant. They used to take this, okay, this type of medicine, because our immune system try to actually reject in those cases, implant cases. So what happened that, okay, I was about to tell what I got from my doctor is that my immune system was misfiring. Okay, something like that. In our the GI tract where the digestion occurs, there are lots of bacteria, and my immune system is taking the good bacteria, or considering good bacteria as wrong bacteria, and they are trying to kill it. And because of this, the chemical they actually produce, and these chemical actually erode the mucus of this tract. Okay, so anyway, so this is the theory, what they say, what the doctor also said, and also I read. Okay, so anyway, so that's why they give the anti-inflammatory drug, which is basically, in my case, is a and that immunodepressant medicine. So they used to continue. Okay, now what happened in 2020? It happened. Now just after 1 year, it again occurred in 2021, like last year. Okay, so now the time gap is 1 year, I'm telling you. And this time I have to had admitted to hospital, and I have to again undergo through lot of tests. Why I have to admit to hospital? This is because, so I had actually this symptom 1 month back. Okay, and that's why, and during that time, when it occurred the first time in last year, so they actually increased the steroid dose to high level. Okay, so 40 mg level. And what happened, like after 1 month it occurred, and there is no scope to increase it further, that steroid dose. Okay, like they can increase, but they didn't take risk to increase it at my home or at my apartment. Okay, so they asked me to admit there, and then they increased the dose to 60 mg, or 75 mg they increased, and they stopped all other medicine. Only that is the thing they did. But this time what they did is that, apart from doing colonoscopy, endoscopy, and CT scan, they also did one more test, which is that called, they actually gave me one capsule, and that capsule I have to take, and it will travel from here to rectum, and during that travel, that capsule will actually capture the photo, or capture the photograph of my GI tract. Okay, so that that was nice, but I have to wear a lot of sensing units to detect that, or to get that images from that capsule. And that capsule is actually manufactured by Philips. Okay, and it's like a capsule of 60 mg tablet, but the top surface is transparent with one something like inside one LED is there, and one portion is opaque where actually the sensing units are there. And it is actually connecting that, the capsule is connected with the sensing devices using Bluetooth. Okay, so that's why they advise me not to use this mobile phone during this procedure, and it takes around 12 to 14 hours. Because the capsule takes like the capsule takes 5 hours to travel from actually the stomach to the little bit lower intestine. Okay, so but when you just swallow, it will just directly go to the stomach. But after the traveling time will be little bit slower, and because of that, they have even that every time you have to really clear all the foods or all the things from your system, so they will give some laxative to do it. But that will give us the clear idea that where are the ulcers are. Okay. I asked particularly one question to because I was very much afraid. Okay, one question to my doctor is it a cancer? Because everybody will fear from that. So she told me, no, it is not a cancer, but this ulcer occurs, and ulcer actually occurs to every human being. But for us, as I told, our immune system is a little bit defective, say in that word. So it never cures very quickly. But in case of normal person, they also get, but it cures very quickly. Okay, that is the difference between normal people and say Crohn's disease people or IBD people, basically. Okay, so why I'm telling you this details that now I will tell you what happens, what are the observation I made. Okay, so I have documented all of my history, say in terms of obviously medicine is there. Also in terms of foods also. So like from 2016 and also dates. Okay, and this may motivate you to do some further research and or maybe getting some new techniques to actually not cure, to reduce this symptom maybe. And I am hoping that after 10 years it may be cured. Okay, people are working on this. This COVID has come because of this, other activities are down, but I am hoping that now it will be up. Okay, so I saw in my case, if I take very particular type of food, okay, it actually this ulcer actually comes. Okay, that is one. Second is if I get tensed, okay, because of something, whatever, and not only my from my professions, other things are also there. So this also occurs. Okay, and also in my case, so that's what I'm saying. If you are coming across with any other Crohn's disease person or any other IBD person, please ask them what is the recurrence when they get. In my case, it is very particular. Okay, dates, like even dates also, what I'm trying to say. For example, like I used to get this symptom in the month of May. Okay, like this month or month of September, October. Okay, apart from these 2 or 3 months or this span, I will never get this symptom. So I noticed this, and I also communicate this thing this time only to my doctors and trying to tell her that why it is I'm getting this during this period. So maybe in my case this is very particular duration, but it may happen for other, like for the other person also, they also getting in a very certain period, which you may also see, because this is my experience. That's why I'm sharing with you that this may motivate you to find that is there any particular pattern during which it occurs, or what is the cause of this. Or as you know that we are also in this research community, I also try to find many papers on this Crohn's disease, and people used to say that this is genetic, maybe this could be because of environment, this could be maybe because of this food habit. So that's why I'm saying that you should check that what could be the possible reason. Now, as I was saying that after this October 2021, my doctor also suggested that you change your diet, because I told her that because I took these things, because of this I am getting this symptom maybe. So now they have changed the diet, and till now I'm okay, thank God. So that's why I'm saying I also searched in net, or I googled it, that there are some special type of diet the people used to take for during this symptom. When this symptom actually reduces or subdues, then they actually they can lead their normal life in the sense that they used to take normal foods, and that is one aspect. And there are also many reasons, say like in Crohn disease, one like there are, that's why there are not a particular disease, like these disease is also affected by again celiac disease, maybe lactose disease or lactose intolerance basically. So not sure exactly that what are the causes of this, okay, that why our immune, like why we cannot say digest all the foods. um, Celiac disease are well known, yeah, lactose intolerance are also well known, but apart from these two, maybe some other intolerance is there, which we need to also detect. So I am, that's what I'm saying, I am very much interested now in this topic, in the sense that although I'm suffering from this, but I'm very much interested in this. I want to try to understand why it is happening, and what could be the remedies in future. So maybe some of you, if you are interested, please carry out this work. And very frankly speaking, only very few people in world, special, they are carrying out this research. Okay, US is there, UK is there. I'm not sure in India how many is there any research going on. So this is very good opportunity that we can open up this thing. And mostly even in US or UK, this research is made of this Crohn or IBD people actually. So, but nowadays, as these diseases are widespreading, and they used to, earlier days they used to call it as a first world disease, not the third world disease. So now this disease has shifted from US to India, maybe some other places also. So we need to find out the possible cures, or also we need to find out why it causes, what is the reason behind this. And if you're able to find this, then many of the problems will be solved. See, there is IBD is a disease. Okay? There is one more is IBS. Okay, that is symptom. And means apart from IBD, IBS has, most of the people has that symptom sometimes. Okay, depending on the foods, depending on other things. So maybe that will also cure basically in future. So this is my experience. Now, if you have any question, please ask me. Or if you think that okay, something I need to elaborate, I can also elaborate from my experience what I gained. Yes, please tell me, Harsha.
Hello, sir. I'm
Yes.
Harsha. I'm a final year student majoring in electronics and communication. So my question is, what do you think about the role of probiotics and prebiotics in the treatment of IBD or Crohn's disease?
Yes, so that probiotic food you are talking about, correct?
Yes, sir. Like, otherwise we can take directly probiotics tablets that
Yes,
are
yes,
available in
yes.
the market.
So, see, as a part of the diet, the doctor will always prescribe the probiotic food. Okay, card is must. Okay, if they are not, say, lactose intolerance or milk product intolerance, so then it is a very difficult thing. For my case, it is not. I'm not. I can take milk actually. So they gave me curd, as well as they suggested me to take idli or dosa. Okay, because you ferment. Basically, we have to take fermented food. Okay, so that the balance should of this say good bacteria should be there in our GI tract. They used to say in that terms.
So, sir, like, once this disease is diagnosed, do you think that we can control this by just changing food habits?
Yeah, see, that's the thing I am doing and I'm trying to do now. Okay, earlier, like from 2016, even 2019 also, when this disease was first told by the doctor to me, and she told me that you don't have any restriction on food. I can take any kind of food. Okay. So, but after 2020 in October, that diet has been changed. Okay. And I cannot take actually any kind of hard food. Okay. Or any kind of cereals. Understood? Like I cannot take prawn, I cannot take musuli, any kind this kind of things I cannot take because these has hard cereals which may actually cut or tear this mucus. So
Sir,
everything is yeah.
do you think this food diet will change from person to person, or like is it constant for everyone?
No. It changes from person to person. If you, but for example, I saw, I cannot confirm, or I'm not definite, but I saw when I googled it that there are specific diets. One like Stanford University hospital, like their health center or the hospital also prescribed one kind of and diet. Okay, if you Google it. So it is not only, I'm just telling you, not only limited to say IIT Bombay or something like this. It is widespread thing. Like Stanford is also coming doing the research. So they prescribed, what I'm trying to say, they prescribe a overall kind of a big basket, what I can say, big basket of food which can, or recommended food which we can take. Okay. Now they first told that you cannot take actually wheat also, even rice also. So it depends on the person. Okay, that intolerance, simple. What I'm trying to say, some person are celiac intolerant. Okay, celiac disease is there. Somebody is lactose intolerant. So it will vary, but mostly they will say that you try to avoid taking any hard foods, even peanuts. Okay, so if you want to take peanuts, peanuts is good for us, but if you want to take peanuts, you have to boil it. If you take, say, for example, the almond, if you want to take pista, any kind of nuts, we need to take actually because we are because blood is coming out. So deficiency is always there. Sodium, potassium, all deficiencies are there. At least I understand. So that's why they prescribe to take nuts, but with this note that either you have to boil it or you have to keep it wet for long duration, like at least 4 hours. Then only you can take.
So,
This
sir,
is
like
that.
I just want to know, like, what are the steps you took for your mental health, like, while facing this Crohn's disease, because it says chronic and like it lasts your
So
lifetime.
yes, so mainly I'm telling you, mainly the doctor prescribe. It's a low fiber. Remember, low fiber diet. Okay. So, but if you open any book or any journal, that everybody will prescribe high fiber diet so that you can actually get rid of constipation, everything. So in our case, first line is that you have to take low fiber diet and it should be digestible. Okay, that is the main thing. Now, whatever low fiber food you can find, you have to take. Now, specifically, like my dietitian, then I actually approach dietitian or actually dietitian actually. So she also prescribed me this thing. You first take, and if you take a new food, then only one new food you take one day and check for few days any symptoms are coming or not. Okay, this is the advice. So I am taking right now from October. I'm okay. Okay. So in that sense, otherwise I know that what happens that after like when this steroid actually doses reduces, then actually the symptoms gradually comes up. Okay. In the sense that if I take all kinds of food, okay. So someday I used to pass not the bloody but loose motion. Okay, that is one of also characterization of this medicine of this disease. Okay, because stool is not forming, and mainly the where stool forms, it is mainly started to form during that ileum part. Okay, as ileum is affected, So it is not able to absorb nutrition from that food. That's why this deficiency comes, and that's why normally the IBD person are not overweight. If you see, if somebody is overweight, okay, he is very much fortunate. Otherwise, we are underweight. And the two, as I told you, two symptoms it will come. One is CBC will be down, like hemoglobin will be down, and another will be weight will be lost. Very drastically, weight will be lost. Okay, and like for example, in October, I had 62 kg. Like 6 months back, before October. Okay, and after October, when this happened, I lost my weight to 52 kg. 10 kg I suddenly lost. But fortunately, I didn't lose the hemoglobin. So it was coming around 16. Okay, so that's why doctor was confident. Okay, so this is okay now. So for us, I forget to mention that what type of test we have to do. One is CBC. Another one is there, which is known as Calcical test. Okay, so that will indicate, that level will indicate the inflation in my body. Okay, so if it is inflated, that actually the GI tract, then that value will be coming very high. Normally, for normal person, that value is 50. Okay, I forget about the unit. Don't ask me unit. That is a standardized value. Okay, so that if it is higher than that, then we have a very big issue with inflammation. See, Crohn is one of the manifestation of this inflammation. Okay, there could be other manifestation also, but that is one of the technique to detect that what is happening. Okay, now whoever has Crohn or IBD problem, don't do stool test. Normal stool test. I actually protein Fecal test is also stool test, but don't do normal stool test. Why I'm saying, or why I'm saying, because every time when I do not any CBC or anything, I used to do stool test. And in stool test, there are many parameters are there, the list. Okay, one parameter within that is occult blood. If you see, so this also somebody is doing urine test also, that occult blood will be one parameter. Occult blood, if it is for Crohn disease or IBD disease people, this will be always positive, irrespective of whether he has symptom or not. Okay, so because anywhere this ulcer is there, and small blood will always come out, which will not be able to detect by naked eye. Simple, but the test will tell you this occult blood is positive always. So what happened? Why I'm saying you, every time used to do, and every time without any symptom, because I have to visit my doctor, and I used to do this test and go to her and show her, and she then one day I told her, see, I am doing every time that this test, and every time I'm getting occult blood positive. Why it is so? I'm not good, because I don't have any symptom right now. Then she told me, don't do any, never ever do a stool test, normal stool test. Every time you will get because of this reason. Okay, so that's why we are not expected to test stool test. Rather, we have to do a special test, which is protein Calcical, and that test is very costly. So at least I saw around rupees 3,000 rupees per test. That's a big problem for people, Crohn disease people or IBD people.
So I think Dev and Dhanish, Dev, if you can go first.
Yes, sir. Good evening. I am Dev.
Yes,
I am from third year in BTech Mechanical, and I am from Ahmedabad. Sir, I have a question. Like, I suppose that for this we are prescribed of heavy medicines, like heavy medication. So is there any side effect of this medication?
Yes. Side effect of these medicines are there. Okay. For example, let me tell you what I faced. Okay, because these side effects will be different for different people. So for if I take high doses of steroid, then lots of pimple will come out. Okay, from here. Okay, from the forehead. In my case, that is one biggest side effects. Okay, and and if I take high doses of immunodepressant medicine, then some kind of uneasiness will be there in joints. Okay, so that is curable in the sense that if you do some type of exercise, something that will go off, but these things will come. Okay, and if somebody is taking these two medicines first time, what I also do, so this stomach pain will happen. Okay, why? This is because that because of the acidity. Okay, so somebody who is taking for the first time, they also need to take anti say that gelusil anti acidic, basically that type of medicine, or some type of like Rentac or some type of digestive type of medicine they have to take. Okay, so this is the precaution. Okay, has to be taken by the doctor. Now, what happens? The doctor is also not experienced. I'm telling you. In my case, so I took this medicine first day, and severe pain was there. Then I was thinking, what happened? I didn't have any problem, and what started happening. Then next day I rushed to the doctor. Then she realized, okay, something has gone wrong, and she then prescribed this anti-acidic medicine. Okay, so again, when the body will be accustomed to this medicine, then gradually that anti-acidic medicine or all these medicines will be taken. Yeah, that is, yes.
Thank you.
Yes, please. Asta, you want to say something?
Good evening, sir. This is Asta Kalita, currently third year chemical engineering student from Assam Engineering College. So my question is that could you again re-elaborate on the fact that why is it necessary to give anti-inflammatory drugs, as you mentioned that it's given for organ transplant?
Yes. So let me tell you. Okay. So this again, I understood from my doctor, and some portion I understood from googling the thing. So this I will present you before you, but you should also a little bit read it. So mainly what happens is that everybody, like this digestive system in the GI tract, has lots of bacteria. Something like I saw like 1.25 crores of bacteria are there, different kinds of. And these are, some bacteria are good, some are bad. Okay, what these bacteria actually do is that they digest the system, digest the food basically. Now, in our case, what happens is that our like another thing. Okay, before this, let me tell you that every time, like this viruses and bacteria actually we are always inhaling. Okay, and our immune system is always every time now also we're saying that it is fighting with this harmful bacteria and viruses. Okay, now for us what happens that our immune system, say our brain, actually thinks that the bacteria, whatever is there in our GI tract, are not good, they are bad. Okay, so now what it is doing is that in layman's language, there will be very, maybe doctor's language, very technical language, but in layman's language is very simple. Okay, that our when my brain senses that okay, I am having some bad bacteria or bad viruses somewhere in my body, what it does, it actually it sends my immune system to fight against that that bacteria or viruses. Okay, now as it is in GI tract, say, okay, and it is detecting that okay, something is wrong there. So the body, my brain is secreting one chemicals, some types of chemicals are there. Okay, it secretes to kill it, and because of this secretion, what happens is that the GI tract actually inflates basically, and these chemicals are basically like an acidic type of thing. And because of this, when they secrete this chemical, actually because of this, they tears this mucus of that of the GI tract, And once this mucus is teared off, then the blood vessels, which actually absorbs the nutrition from the body, they are now direct contact with either the food, okay, or the chemicals. Okay, means that chemicals is produced by us only. Okay, now this when this food actually passes through. So it has now inflation has occurred because body is sensing something is wrong, but it is not wrong there. Okay, but it is sensing it is wrong, something is wrong, and it inflates that portion as well as it secretes that chemical basically. Now what happens? The food has to pass through that track sometime. Now when that space is small or it is constricted, so the food is means giving more friction against that wall, and then this blood will start happening, means coming out, because something is rubbing against. And the hard thing is, if hard thing is rubbing against a soft thing, you understand that there will be some kind of wear and tear. So that is basically ulcer. Okay, similarly, and that is actually cut by this food or maybe some chemicals, and this blood will come out from this this blood vessels. And there is a very special name, I forgot that name, Billy or something is there, that name, okay, that blood vessels, and that is actually creating a problem.
Okay, sir, and again,
just to interrupt you, I
okay.
hope you have seen already some photographs of colonoscopy of like IBD people. Have you seen?
Yes, sir. Yes, sir.
So you will see it's a white color, like ulcer type of thing. I mean, it looks like a white, but it's a some like some skin will come out. Simply. Yes, please continue.
Yeah,
So,
yes, sorry.
so could you also explain about your recurrence of the IBD disease during a particular month?
So right now, telling you, I can share this data. Okay, even I told Dr. Das also that I can share that data because I am very much particular about writing this. So normally in the last week of May and during the Diwali time, okay, like October. So what happens, and what my doctor is saying right now is that this is maybe because of heat. Okay, but I'm not convinced right now because this has to be thoroughly researched. Because in October, what happens in Mumbai and as well as May, so this is very hot month. These are two hot months, and as I don't have any food restriction, I used to take okay from home cooked food as well as from restaurant food. Maybe something is going wrong there. Maybe. For my case, okay, it may not be same for all, but for my case, what I have noticed, this one. So one of the main problem I'm telling you in this disease also, first, that people neglect this disease first. Second is, they don't also keep the history of their occurrence. Okay, very much, if you track all this thing, no, maybe something will come out. Maybe something will come out. I'm not sure. But I have kept all this thing with me. If somebody is interested, I am very much happy. I will be happy to share my data for this research, basically. So right now the occurrence is, I can say 1 year.
I can see Yash. I can see Yash, and then I think Jay have their hands up. So Yash, if you can.
Yeah, hello sir, I am Yash Panchal. Good evening, sir. I am Yash Panchal, pursuing BTech degree in biomedical engineering from SJSITS Indore. Sir, my question is something personal for you. Sir, are you birthed by cesarean method? The operational method?
I have to ask my mother. Just 1 minute. So my mother is present here. Sorry. So yes, I was. My birth was normal.
सर आई थिंक कि मुझे ऐसा लगा कि जैसे कई बार ऐसा होता है कि हमारे इसमें कुछ कुछ हार्मोन्स जनरेट नहीं हो पाते, तो उस कारण से इन्फ्लामेशन भी हो जाता है कई बार, जो नॉर्मली हम देखते हैं कि, तो उससे मुझे ऐसा लगा कि
नहीं, you are correct. I'm saying, see, that's what I'm saying. You people should come forward, okay, and do the research. Again, I'm saying, if you open right now, it's a high stress on this, thrust on this thing, okay. People are trying to cure, and people are predicting. I don't know that within 10 years this should be cured. I'm hoping that, okay, like for 10 years I have to sustain this somehow, then it will be cured. But you people has to tell. Okay, I don't know.
I think before Jay asks his question, so I must just tell everybody that it was just by chance that when I reached out to Dr. Saha, he mentioned that when we were trying to form this foundation to do research and like with biomed, MBBS students, engineering and all, I just reached out to Dr. Saha saying that are there people whom just like we reached out to Dr. Dheeraj, it was a call like this. And he just said that, look, why you don't have to look further. I myself am a sufferer, and knowing Dr. Shah's way of keeping records, and you can see the frankness with which he has come to tell about it, of something which we don't tell, because our mother also went through the same kind of thing for almost 6 years. And we know how difficult it is in terms of weight loss. And I think there was a question from Dhanesh regarding how do you keep your mental stability in spite of all the things that is going wrong. And colonoscopy is not easy. It is a very, very difficult thing. Although Dr. Saha may be presenting it in a very light, jovial way, and you can see his smiling. But let me tell you, there is a lot of pain. There is a lot of things going on. And that is where I think that the things that he is pointing out, like how do you keep a regular tab on what is going wrong, what is going right? I think that is where many digital interventions can come up. Similarly, as he said, like that medicine, what he was talking about, it is very, very costly. Maybe only certain hospitals may have it. Like what are the protein things? So I would not like to put my words in your mouth, but I think this is an excellent opportunity to learn as well as to think what as a doctor, medicine, biomedicine, biotech, engineering community we can bring to the table. So I see Sujitesh has also joined. So Jay, yeah, sorry, I stopped you in asking the question. Sorry, please go ahead.
It's okay, sir. So my question was, so whenever you must be having some specific diet or some things which you eat. So whenever you go out, as in you go out to travel and also, how do you manage your diet?
Yes. You asked me very nice question. Okay. See, now I haven't. What I can say, I haven't gone out simply because of COVID restriction. I have, that we at least I used to travel a lot because of this project review, everything. Okay. Now, normally, what I used to do nowadays is that I carry my own food. Okay, because they have prescribed me. Okay, you can take only say rice and dal. Okay, I cannot take very spicy food. I cannot like eat very hard food, and should be properly cooked. So this can only be sure that I can take food. No, it's not possible. Okay, for example, I for say went for duty is Bombay. So I have to stay there for 2 days. Will do. Take like that cook one day, half day. But so normally what I used to do, I just like so for me the non-vegetarian part is not restricted, okay, except red meat. Okay, so I can take fish, I can take egg, I can take also poultry. no, I mean, apart from this, I cannot take anything. Okay, so and it has to be also cooked properly. So what I used to do, what I used to did during that time, so I only took like a low spiced biryani, very frankly speaking. So I noticed that I was okay. Okay, means I don't have very other like loose motion. That is first indication. Okay, so I survived. Okay, now I have to travel a lot. So what I am thinking that I have to again consult my dietitian to modify my diet so that at least I am okay. Because again, I cannot get that low spice food everywhere. You are correct.
Thank you, sir.
Uh, yeah, Professor Saha, thank you for really sharing this personal experience of yours, and I'm sure this being circulated among the first generation engineers and the doctors, this is going to go long way for them to
Yes.
think about it in a very different way, how to find a solution for this
Yes.
medical problem. So I'm really very thankful for you to be here and sharing this experience of yours. And uh, yeah, sir. And so I think we are ready to close the session. In case you want to say some few words for our interns, like who are from MBBS and engineers, it will be very helpful.
So as I told you that please do something. I must do. Okay, and
Mhm.
maybe it means you may not get result overnight, but if you are interested and you are behind it, it means it's a very good. I can say it's a very good research area because we are from like we are doing some research. So that's what I'm saying. It's a very good research area. I'm saying okay, and not many
Mhm.
papers are also published. Okay, and not many things also is means people know. Okay, so this is very good opportunity that if you can do something, you will be actually famous. Very frankly speaking, my words. Okay, so
Mhm.
and also please spread the word. Maybe like USA, we
Mhm.
have many of us may have this symptom. Okay, for example, I will not take much time. Like I was taking one PhD interview like 3 years back. Okay, it was physical interview, and one student he was very good he came from IIT Guwahati. He he asked he told me that he has to he told the panel that because I was the part of the panel, he told us that he has to go to Vellore and other places to take the medication, whatever. Then I told him what is the problem. So he told me that same like what I described, but he used to get within like a week or within a month, and because of this, he actually suffered 1 year in his MTech in IIT Guwahati. I forgot his name. I don't know what what he is doing now. But I'm telling that people actually don't know this thing. Please spread this concept and like concept or symptoms so that people don't take it as like a loose motion with blood one time. Okay, no, not like that. Okay, so like in Bengal we have a very famous word and we used to say that every time. Okay, and people neglect this because of this. Please spread this word fast. People will come, and if they know that this is their disease, they automatically will get the data. Simple. If you have to be patient. What I can say.
Uh, yeah, yeah,
Thank
I
you, Dr.
completely
Sir.
agree with you, sir. Yeah, yeah, yeah. Dr. Das, you can close the session, please.
No, no, what can I say? I think I just wanted to say thank you. I think I cannot say anything more to my colleague and friend
Mhm.
for many, many years. So I hope, Dr. Sandip, you keep yourself well and keep up the strength mentally and physically. And I'm sure that, this little team that you see here will definitely try to do something. And I'm sure that people,
Yes.
there will be people also working with you. I'm sure now that, again, congratulations for becoming a professor. That's another big win
Thank
for
you,
you
sir.
in your journey, in your academic journey. And now I think you can actually do a lot of research in this area. So
Yes, yes, that's right.
keep up the good work. I think somebody has raised
Somebody has
his or
raised
her
his hand.
hand.
Yes,
Satya, I think.
Hello, sir.
Yeah, so
I just
Satya,
have a
please.
small doubt. Hello, am I
Yes,
audible? Huh. Sir, I
yes,
just
yes.
have a
You are audible.
sir, I just have a small doubt. That is it compulsory to eat something every time so that you don't get this disease? Is if you just skip a meal, it would be a does the disease increase in its level exaggerate or something?
Hmm. Yes, yes, yes. Disease is always there. Okay. Only it increases or exaggerate or it subdue or reduce. Symptom reduce, but it is always there. Okay. Means if you even right now somebody is means if the colonoscopy is done, he will get some kind of sort of ulcer. Okay. Disease is there, but how to control it?
Sir,
Well, this is right now. This is the motive, like what the doctors used to. I am telling you more than that. You have to now go to that.
Sir, matlab, if you skip the meal for, if instance, if you forgot to eat meal, would be there any exaggeration of symptoms like in a day
I
itself?
one more advice is also that I cannot skip any meal. Although if I can, I have to take small amount, but I cannot skip any meal. This is one because of this we don't get proper nutrition. Okay, that's why we always advise to take meals, and but in a small quantity. But what you are saying, no, like say for example, when I was admitted in hospital, I like they didn't give me any foods for 5 days. Okay, it didn't supplement, it didn't reduce. Okay, and for my case, it takes 6 days to reduce, means completely. So which I noticed. This is again one more. So it varies again for person to person. So it's not like that if I don't take food, it will make you. No, it is not like that. It will be there. Ah, only thing it will means my body or the medicine, or my body assisted by medicine will cure it. Ulcer means body has to cure. Nothing will happen. Okay. So what actually? Let me tell you very simple thing. This steroid actually just increase the thickness of the mucus. Okay, not it is more, not more doing more than that. Okay, that's why it is preventing from blood is coming out from the vessel. Okay, that is only the part. Okay, but thing is that that's why. So when this injection is like high doses is given, expected that this mucus will form very quickly and blood will stop. But for my case, even if I skip meals, still it will be there, which I noticed. Okay.
Sir, one more question. Did the doctor give any possible explanation for the cause of the disease as it was not genetic or any uh, habits and all?
No. So this is, I mean, that actually doctor didn't comment. Okay. So what I read, I told you. Like it could be genetic disease. Yes. Last time my doctor asked me that in my family there is any such kind of immune problem or not. But at least I asked my mother, like my other relatives, they don't have. Okay. As I told you earlier days, nobody knew about this disease. So nobody will give you clear idea whether his or her family has this disease. Telling you very frankly. Okay. So you will not able to detect in India whether it is right now at this generation. Maybe after my generation, they may be able to detect because now we know. So my like earlier generation, they said that they don't have any disease. So there is no possible right for me. There is no why I got this thing. I don't. That's why I was
Thank you, sir.
beginning. I told you I don't take this thing. Still I got. I don't know. That's why you have to do say research. Maybe environment has changed. Something has changed. I don't.
Yes, sir. Thank you, sir.
Yeah, Amgad.
Yeah, good evening, sir. My name is Angat Tiwari, and I'm an intern medical student at Government Medical College, Jhansi. I do not have any question for you, sir. I just want to take a moment of appreciation for you because I believe, being a medical professional myself, I understand that it is extremely tough to open up about your medical condition on a public platform. So, thank you so much for sharing a story with us, sir.
Welcome.
Thank you, sir.
So it is not only that what like Dr. Das told. It is not only the medical thing. It is also mental blockages there during, or mental distress will come. Okay, during those periods. Okay, for example, when this happens, I cannot concentrate on my work for those 7 days at least, but maybe after that 2 months also. Very frankly speaking, that not only it cause physical problem, but it also severely cause this mental problem. That we have to also see that the patient has to be also treated from that point of view also.
Hello, sir.
Yes.
Hello, sir. This is Shubhi, and I'm a BTech Bioengineering student from VIT University, Bhopal. So, I just wanted to ask one question: that can mental stress or like any kind of pressure for work, which alter the bowel habits, might lead to
So
IBD in future?
yes, that I noticed. Okay, that whenever I got the symptoms, maybe 1 or 2 cases at least, I have noted down that there was some tension. Okay, so actually, if this is normal or general, that if somebody has high level of stress, okay, so either that will be manifested by some means. Maybe in our case, this is manifested in terms of this, symptoms or IBD problems. Okay, at least for my case, 2 or 3 times I noticed this. Okay, so that's why I mean the stress is it's a very bad thing for us also, but for everybody also.
Yes, sir. Because I personally take a lot of stress, so I just wanted to confirm this. Thank you,
That's what
sir.
I'm saying. So please reduce stress. For my case, it may manifest it. That's why I'm saying again. So see, I have my email ID just to tell you. If you have any more questions right now, you may not remember. Just let me know. I am very much free to give the answer. And why? Because I understand that this has to be solved sometime, basically in future. Obviously I will be cured. And there are many people are around us right now. What happened? No, when I went to hospital, now I came to know that many people have this problem. This like my generation people, not the earlier people. Okay, so some they have gone more severe condition than me. Okay, uh, uh, but saying that means you are the starting back. Please do something so that we can get
Yeah.
good medicine or cure.
Yeah. Yeah, Professor Saha. So I think with this we will close the
Yes, yes,
session. Actually, next speaker
yes,
is
yes,
already in line.
yes, yes,
Yeah,
yes. Please.
I'm very thankful to your sharing your experience. Yeah, thank you.
Okay, I am disconnecting the call.
Thank you.
Thank you.
Thank you, Sandip.
Thanks.